Right. Hi, everybody. Welcome once again to this information session that's offered by the Department of Population, Family, and Reproductive Health here at Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. And we're really excited that you have joined us today to learn about the department and our programs here at the school, as well as how our students engage with faculty in the department. So I'm not going to share slides at this point. It's going to be mainly a discussion for the first half hour with Dr. Gross and our student Aaliyah, and they're going to tell us a little bit about a project on which they collaborate. And then at 12, around 12:30 Baltimore time, or in a half an hour, we're going to switch to talking about our degree programs. And so that's the time that if you have specific questions about the application process or degree requirements, we'll get into that. But again, the first half is going to be focused on this one conversation about a faculty student project. Feel free to ask questions at any point, either come off mute, raise your hand, or drop a question in the chat, and we'll get to all of your questions. And so I just want to say a couple of brief words about the department generally. So PFRH, the Department of Population, Family, and Reproductive Health, is one of 10 departments in the School of Public Health here at Johns Hopkins. And the department has a long and rich history. So a couple of decades ago, the Department of Population Dynamics, which was more internationally focused, merged with the Department of Maternal and Child Health that was more domestic focused, and we became the Department of Population, Family, and Reproductive Health. So the work of the department is very diverse, but we're all united in our focus on promoting health and well-being across the life course, and using that lens to focus on promoting health equity. And so we're excited that you're here today. We'll talk about a little later on, we'll talk about the different areas of interest within the departments. I know that population, family, and reproductive health can be a bit of a mouthful, but we have students here who are interested in maternal, fetal, perinatal health, child and adolescent health, women's sexual and reproductive health, as well as population and health. And it's okay if you don't fit neatly into one of those boxes. We have those specific areas of interest to try to guide students as you're here going through our programs and connect you to the right courses, resources, and faculty. But again, the work of the department is diverse, and we hope that we can help you find your place here. So again, I'm going to talk about our degree programs a little later, but I want to turn now to our spotlight discussion. So I'm delighted to welcome Dr. Susan Gross and MSPH student Aaliyah Lopez, who are here to talk with us today about their work. And so to kick us off, could I have the two of you introduce yourselves? Maybe tell us a little bit about your specific research interests or areas of work.
Thanks, Sally. I guess I'll start. Good afternoon. I'm Susan Gross. I am Associate Practice Professor, and I also am the Director of the Johns Hopkins Book Program. By training, I'm a registered dietitian, and most of my focus has been on maternal and child nutrition and food insecurity and federal nutrition programs. I teach two classes. One is nutrition and growth in maternal and child health, and the other is nutrition programs, policies, and practices for families in the United States. And most of my research has focused on the evaluation of federal nutrition programs such as WIC and the school lunch program and other safety net programs. And a lot of the food access projects I've been working on relate to the WIC program, and I'll talk about that a little later. But one great thing is I get to be a preceptor for students. I have registered dietitians come do practicums in the WIC clinics. I also have a lot of students come do their field placement or practicums in the WIC program. So it's great to work with students. And I'll pass it over to Aaliyah.
Hi, everybody. My name is Aaliyah. I'm a second year master's student in the Pop Fam department, and my concentration is in the maternal, fetal, and perinatal health. I also had completed here at Hopkins a certificate in public health economics, And that was really just to understand how policy and financing shape access to care. Um, and then before my master's, I worked as a WIC nutritionist in New Jersey for 2 years. And that experience was really meaningful for me because it showed me firsthand the structural barriers that families face when trying to get access to healthy food and other healthcare related resources. And I think it pushed me to think beyond the individual behavior of what I was doing in the counseling and to think more about systems level change. So that's how I got here to Hopkins. And my research interests are also very similar to Dr. Gross, which is broadly in maternal and child health, health equity, Latino health as a first generation Latino student, also breastfeeding and food access, I would say. And then long term, I'm planning to do my dietetic internship after I graduate here at Hopkins, which is amazing because I get to bridge the clinical nutrition training I will receive with my public health background to better support families. And I've also been a teaching assistant with Dr. Gross and also in other departments and work as a research assistant as well here in PopFam and also in the Health Policy and Management Department.
Awesome. Thanks so much. And we'll talk about certificates for those interested. And I have a cat guest here as well. We'll talk about certificates that you mentioned, Aaliyah, and we can, for those of you who are interested in the MSPH program in the PFRH department, which is the program that Aaliyah is completing. We'll talk about the field placement and master's essay. But yes, you've definitely taken advantage of the many opportunities here at Hopkins. So I'd like to turn now to have a discussion about one specific research project that you both collaborate on. And so could you tell me a little bit about the project that you'd like to share? Maybe if you have an overarching research question for that project, talk a little bit about that as well as your specific roles and how you work together.
Sure. So, over the last couple, I'd say since the beginning of the pandemic, I've been working with the Navajo Nation and with the Navajo Nation WIC um, office specifically. And the reason I got involved at first was because they noticed that the enrollment in Navajo Nation WIC had declined. So, with some students in PopFam who have graduated, we did a formative research on what were the drivers of the low participation in WIC. And one of the large things that came out of that was that there was a lack of accessibility because of lack of transportation to WIC food vendors and WIC, just basically food accessibility in general. So the next step became the project that I'm the principal investigator on and Aaliyah is assisting. It's a feasibility study that we are looking to see if it's possible to provide online ordering and online delivery of WIC foods to WIC participants in the Navajo Nation. So this project is funded by Robert Wood Johnson. And the first step was to actually say, what are the barriers? And we did, this is where Aaliyah started the program and said, I'm really interested in this. And food access is really important. And I said, come on over. We need students to work with us. So Aaliyah started right away to be working on this project. It is a three-phase project. The first was formative, which we completed a lot of interviews. And we're going to do a site visit actually in a couple of weeks and talk to stakeholders. And then the third phase is actually doing the delivery. And I got to let Aaliyah talk about all of the ways she helped with this project.
Yeah, thank you, Dr. Gross, for introducing the project. You know, as a research assistant and former WIC nutritionist, this work feels so aligned and personal to me and benefits to support their health, but the access or how they use it isn't always straightforward. straightforward. And the WIC clinic I worked at was in primarily urban community with supermarkets. Oh, this is my internet is unstable. Am I okay now?
We can hear you okay. Yeah, I'll let you know
Can you hear me?
if we can't hear you. We lost your video.
Okay, yeah, I just said my internet was unstable. Um, Sorry about that. So, bringing that previous experience on this project on the Navajo Nation, those challenges that we already see with WIC were even more pronounced. Like Dr. Gross said, some of the barriers, and that just kind of was like super aligned with my interests. And I had the opportunity to be from the beginning of when we were doing the IRB um, revisions and just sending it out. And so, kind of where I started was designing recruitment materials to support the participation, enrollment, making also communication materials as well. And so that was kind of fun to ease my way into it and become a bit familiar with what we're trying to do. And then as the months went on and we were able to get families or other stakeholders to participate in qualitative interviews, I served, I would say, as a lead interviewer for the qualitative data collection, conducting those interviews with WIC participants, WIC staff, uh, other home visiting providers to further understand what are some of those barriers to food access to help inform, this pilot project that we're doing. And then that has been going on the past few months. I've also had the opportunity to develop other surveys to once again assess that feasibility of the participant experience in this online ordering and delivery pilot that we're doing. Over the summer, I got to use Stata, which is one of the statistical softwares that we learn here at Hopkins in the Biostat series, um, and really do that secondary data analysis of 5 years worth of WIC data to understand how are families using, these benefits, what are they buying, where are they buying, what store type, to continuous like to inform that design in partnership with one of the food companies that we're working with to help do this pilot program. And in terms of collaboration, I would say that we meet weekly to discuss these findings or share any insights that we've gathered from a data analysis or the qualitative interviews. And the people on the call are also from Navajo Nation. We have the Navajo WIC director, and we also have researchers from Navajo Nation who have done the GIS mapping and help support us to make sure that this project that we're doing remains grounded in the community priorities. So that has been also really interesting for me um, to create updates that we will give in our site visit to the chapter houses to inform them of what we're doing, what are our findings, because that also is important to make sure that this is a respected partnership, which is something you think, oh, like, of course we want to do that, but how you do it also matters. So there's been so many learning curves, and especially working it, or like, given that I live here in Baltimore, I would say like conceptualizing how rural areas are and remote uh, areas within the rural communities can be for families also was really eye-opening experience that you hear about in the classroom, but when you talk to a mother, it is a very different experience. So I'm very thankful also to have amazing supervisors and Dr. Gross to have their let me, kind of do what interests me and respect my voice as a research assistant and my perspective. So it's been a joy to do this project.
Thanks so much to both of you. And Aaliyah, it's great to hear how involved you've been in the project through really different phases and doing a lot of different work. So, from like participant recruitment to conducting qualitative interviews, analyzing quantitative data, and then all the way taking it back to taking the findings back to community partners and having a discussion there. That's great to hear about. Can I ask, how did you get
Yeah, and
involved
oh, sorry.
initially? Oh, go ahead.
Oh no, finish your question and then I can add whatever.
Okay. It sounds like you linked up with Dr. Gross fairly early in the program. Can you tell me a little bit more about how you found that connection?
Well, I believe one, I had looked, in the within the department faculty to see who my work and research interests align best with. So when I do move, I was like, okay, I will, seek her out. And the department had these like faculty meet and greet opportunities, very relaxed space, and just like some faculty come in, and I went and introduced myself and shared a bit about my background and my interest. And she was like, I think I have a project for you. But that was in the term one, which is, in that August, September period. And then I joined in on the project in January, which is term three. But interestingly enough, a lot of my friends and roommates had gotten research assistant positions in term one and two, which is pretty fast as a first year student. And in one aspect, I felt like, am I behind because I don't have a RA ship already? Like, but I knew that in that conversation I had with Dr. Gross that I wasn't going to take on maybe the next opportunity that presented itself because I know that there was something aligned coming my way, but I just had to be patient. And so I think given that things were not happening as quickly, I just had to like get out of my own head. And when Dr. Gross emailed me with, the full blown opportunity, more explain like my role and the contract and everything, I was like, oh wow, I'm so happy that I had waited instead of just taking the next gig that was offered because who knows if I would have been as involved or enjoyed it as much as I am now. And what I was going to add before the question was that, this project has really taken a life of its own in my personal life that I one got to present it got accepted at the American Public Health Association conference and I got to present it as a student poster in DC and had the opportunity to network with other public health professionals and students and that was such a great experience and through there I even got to join the Latino caucus where I get to do more policy aligned work which is amazing and then also the school had the Public Health Honor Society poster competition, and that also won second place in the policy and practice category. So you just never know like where your passions can take you. And I didn't go into this project thinking any of those things would happen, but the work that we do here is really just trying to improve millions at a time. And I didn't really knew what that meant until you are doing a systems level project that does have the opportunity to improve people's lives. And
Thanks so much. Congratulations on those accomplishments, sharing the work, and I appreciate what you said. I mean, I think that if for those in our audience, if you come to the department, you will hear me and others say, like, do what Aaliyah did in terms of ease yourself into the coursework. And my recommendation is to not jump into projects immediately and to wait until, the winter or spring of the first year that you're here. So even Aaliyah, if you felt behind, I think that that would be my recommendation. And then I also appreciate you talking about navigating one of the most common challenges, I think, for students here, which is just that there are so many opportunities, and it's almost like a choice of what to turn down, and so many things can come your way. And I think that, and we'll talk about this later on in this session, but we want to make sure for all of our students that you have the support that you need to navigate those decisions and know when to say yes and when to say no. And so you I imagine, Aaliyah, that you relied on peers and advisors and other faculty in the department to help you make those decisions. So I appreciate you touching on all of that. I did want to ask if you both could share a little bit about like big picture public health impact about this for about the project that you're working on and what you feel like the big accomplishments are there.
So I think the big picture impact is this is the first feasibility study of its kind in WIC, especially on in a tribal, and it's also because this project is led by the Navajo Nation WIC, and we are just assisting, but actually the results of this project will be used to inform the online ordering and delivery of food projects for other tribal organizations as well as rural WIC um, agencies. It's also prompted collaboration with the Center for Indigenous Health here at Johns Hopkins. They have a family spirit home visiting model that's international, and so we're collaborating on how we can work together. So I think all of this is very timely. WIC is modernizing, so this is one of its goals. So we know that it will the results will go beyond this. We also hope to we are working to do another phase after this feasibility to actually integrate this model into the WIC program, MIS.
Yeah, and just to add, I think for our project, to improve access to WIC also has the potential to improve diet quality among the participants in the program. Increasing the participation also helps reduce access related maybe burdens that can happen and strengthen, I think, how much is redeemed in the program because they do get a variety of foods. And I think also it has the opportunity to support local food vendors and contribute to strengthening the local economy. So it's not just only our program as that benefits. It's actually a bit of everybody. And I think that's what, for me, that this project means is that it's not just about improving one program. It's about getting evidence that we can actually create something that is equitable in an area where it's very hard and there's other, factors that influence why. Oh, sorry. Yeah, that influence how we got here. And I think this is also about making, you know, nutrition services accessible. And at the national level, we can, have a almost a trickle down effect and making sure that the solutions we're creating are grounded in the actual need and not just what we say they need. Um, so yeah.
Um, I didn't get to say before because people may not be familiar with the WIC program, but it is a federal nutrition program from the United States Department of Agriculture for women, infants, and children, but it is evidence-based. It has been shown to reduce infant mortality, improve pregnancy outcomes, improve child growth, improve diet quality, like Aaliyah said, and decrease food insecurity. So yeah, um, by improving access to WIC, we improve other outcomes as well.
Thanks so much. We have a few more minutes with you, so I want to turn it over to the audience and see if folks in the audience have any questions. Feel free to come off of mute, type your question in the chat. Maybe I'll ask Aaliyah one question. Did you use this experience for either was it tied to your field placement or to your master's essay, or did you use different projects for those?
So for my master's essay, I'm doing the analysis of a public health problem. And for the prospective students, we have multiple options to choose from. So that was one. Because of the barriers and the qualitative interviews, I was like, I want to explore more of how the WIC modernization, like what I guess are the issues in that, because it's not like the WIC program is not really uniform nationally. It's like each state kind of has their own way of rolling out these modernization efforts. So I wanted to explore equity in WIC modernization for rural and tribal communities. Initially, I did have it as my field placement, um, but I didn't end up submitting the form for it. So what I had, even though I had done like all the work as if it was a field placement, my field placement was at the Maryland Department of Health in the Maternal and Child Health Bureau. Oh, hello. And that was my field placement that I did for 6 months and then extended it. And I'm now transitioned into their public health internship program till I graduate, and hopefully I can work there in the summer again. So yeah, I have an interest in like policy and practice. So this the school and the practicum experience allowed me to have both research and real world or practice. Yeah.
Thanks. It's great to hear how you took something that you learned in your field placement and then turned that into your research or your master's essay. Like you said, there is a lot of flexibility to do the type of master's essay in terms of format. Like you could do a research report or a policy analysis. And so you took an idea that was sparked, I think, by this work and moved it forward for your master's essay. And then again, sounds like you could have used this experience for your field placement, but you had other opportunities as well. I'm gonna again see if anybody in the audience has any questions.
What made you want to focus on maternity?
Could you repeat the question?
What made you want to focus on maternity health?
So maybe why what made you focus on maternal health?
Me or Dr. Gross?
Do you want to take it,
Alrighty.
Aaliyah?
Um, so I think for me, maternal health, I remember my undergraduate, I studied nutrition and psychology, and I learned about like the first 1,000 days and just, the impact of nutrition. And so I've always loved working with children. And after I graduated, I didn't go into my dietetic internship because of financial reasons. And so one of the opportunities was to work in my town in the local WIC clinic. And it just felt like a shoe-in deal, like to be able to do community nutrition. And I think working with mothers, they have a lot of challenges, but also strengths that allow you to influence like the family structure. More than likely, a lot of the moms I had worked with were the cooks, were the food shoppers, and made a lot of decisions. So I saw it as a way that, for me, an intervention, if like I'm going to help a family, at least it will have that effect on everyone, not just like that one person. Um, so yeah, that was for me my interest in working in
So
maternal health.
yeah, so I have being in nutrition, I realized that the best way to impact outcomes is to start as early as you can. So working in maternal health, especially preconceptual nutrition, really has a huge impact on birth outcomes, but also mother's health. And I've done quite a bit of work. We're lucky in WIC that we get contact with a lot of women during pregnancy, before pregnancy, during pregnancy, in between pregnancies. And we get to also, as a high risk nutritionist, I got to be the one who also helped them with other health issues such as cardiovascular health or with like high blood pressure or diabetes or even just things with like thyroid. And I'm now working actually with a researcher in epidemiology. We're going to be working on breast cancer screening in WIC because we do so much with breastfeeding. and breast health, and hopefully develop an intervention for early breast cancer screening for the moms. So I'm excited about that.
Thanks. And before I let you go, I know we're at 12:30 here in Baltimore, but would you mind sharing, shifting gears, would you mind sharing a little bit about what you like about living in Baltimore? Either of you can start.
So I love living in Baltimore. I actually grew up in California, Northern California, and I moved out here. One of the things I love is there's so many communities in Baltimore City that you get so much cultural diversity. There's a lot of activities. It's a beautiful place. There's a lot of parks, um, and a lot of activities related to music at the Inner Harbor. And yeah, because I'm a food person, there's so much great food in Baltimore. So that's like some of what I love.
Thanks.
And for me, I think I grew up in New Jersey, and so all of my undergrad training was in New Jersey, and Baltimore was really the first time I stepped out of home. So it was a bit of transition for me. Growing up urban community, everything is super close, and luckily, Baltimore City has changed so much over the years after connecting with a lot of more people who are native Baltimoreans to hear how the community has changed. I think has been very special because you hear a lot of things about Baltimore and you come with some precon preconceived notions about what it is. And I think until you meet the people here and explore for yourself, yes, there's going to be streets maybe where it's like one block difference and it's like, whoa, okay. But on the flip side, there is so much great things going on. And so I recommend if you do decide to come here to, get involved in the community in ways that are meaningful to you. Um, Explore around the parks, the waterfront. I love playing tennis at Patterson Park, running there. I did the Baltimore Half Marathon, and just the energy was so great. And coffee shops. Um, so I've managed, to find things that I enjoy, but also be open to new experiences. And my neighbors are also friendly. When me and my two roommates moved in, they were like, we're going to look out for you. We're so happy you're here. And I'm like, wow, that's so nice. Thank you. And I think, yeah, also to the community I've built here has made Baltimore a lot more enjoyable. So branching out outside of your department, if you decide to come here, I think will be also really special because you're not alone. Most likely, most people who come to Bloomberg are really not from Maryland. Um, so I love the international students I've gotten to meet. It even inspired me to start learning a new language. I've been practicing Brazilian Portuguese for the past few months because of all the amazing people I've met here. And so I just feel like a big sponge, not only in school, but also in the Baltimore experience.
Thanks so much. I will just quickly echo my love of the green spaces in Baltimore as well as the food scene. Those are just two of the many perks of living here. So thank you so much. I see some words of thanks in the chat to you both, Aaliyah and Dr. Gross. Thanks so much for being here and sharing your work on this really important project. And you're welcome to stay on, but I imagine you have many other things to do. So I'm going to turn now to talking about our programs. I see a question in the chat that I'm going to answer, but thanks so much to you both again for being here.
Yeah, thank you for the opportunity. And if anyone else has any questions, feel free to reach out to me in LinkedIn, or I can put my school email in the chat. And then, yeah,
Thank you. Thanks.
I will also put my email in the chat, and I encourage you, if you're interested in anything related to maternal and child nutrition or WIC, please contact me.
Thanks. It's very, very generous of you. We appreciate it. All right. So I did see a question in the chat about what I said earlier about maybe waiting until you're settled into courses to start research projects or research assistant positions. And I think it's a very individual choice. Some people come and they get started right away. And you might have financial considerations that are important to starting a job right away. And some people do, whether it's through federal work study or other opportunities, find positions to get started on right away. I think my general advice is to just take it slow. I think what Aaliyah said was important in terms of she waited because she eventually got to this project that she was sharing about today, but that opportunity wasn't available right at the beginning. And so I think she waited to find something that aligned really well with her interests. And she didn't start that right in August when she started the program. She waited until like December or January. So just a few months. But then I think that can also just waiting a little bit can give students a little bit of time to settle into the pace of courses. So one thing about the School of Public Health here is that we are on a quarter system. We call them terms. So rather than have courses for a full semester, we change courses every 8 weeks. So there's a set of courses that you would take in September and October. You get like a day break, and then you switch to a new set of courses in November and December, and then the same in the spring. There's 2 terms. And so it can be a lot to adjust to as a new student, but no, there's no one right answer, no one size fits all. So if you do really want to get started on research projects right when you get here, you're welcome to do that. I would just say it's a little bit of a balance of waiting to find the right opportunity for you, as well as all of the other considerations that you have that are important to figuring out whether you're going to start a new job or a new project right away with classes. All right. So if there are any other questions that I'm missing in the chat, please let me know. Um, yeah, I think I should have asked Aaliyah to talk about it a little bit. I think that the term system it can be an adjustment, but then students get the hang of it. And I think again, just don't overload yourself that first term when you first get here. But every people adjust and they succeed. And I think that there are benefits to the term system in terms of you get to start learning something new, you get to have a whole new set of courses, and you get to take more of a variety of courses than you might if it was a semester system. But along with that, there are some courses that are sort of in a series. So we have statistics series that you would take for 2 or 3 or 4 terms in your first year. There are some other courses that work like that. Even Dr. Gross, she teaches a course in both term 1 and term 2. And so if you wanted to take both courses, there'd be some continuity in the topic and the teaching style and all of that. So there are ways to find those longer term opportunities. Um, yeah, so I have slides, but in full transparency, I have presented those slides at other info sessions that are recorded and up on our website, and they go through all of the details of the programs in our department. So specifically the Masters of Science in Public Health, the MSPH, the Masters of Health Science or MHS, and the PhD that are based here in the Department of Population, Family, and Reproductive Health. I looked at who had registered for the session, and I think we had a mix of people interested in those programs, as well as the school-wide MPH program, and maybe even some programs based in other departments. Would people mind just dropping into the chat what program you are interested in here at the School of Public Health? And thanks to Mary Alice for dropping in the link to the previous recorded info sessions. And if you go to those recordings, there is I present slides and a lot of info on our programs. All right, I'm seeing one person who's interested in the MSBH. I'll assume that's in our department. What else? What other programs are people interested in hearing about? So an MPH, MSPH, PhD. All right. I'm gonna go through a little bit of the info, but I want to make plenty of time for questions. Sorry about that while I start sharing my screen. So here you can see the, whoops, you can see the different programs offered in the department. So we have a 2-year MSPH. Sounds like a few of you are interested in that, as well as a 1-year MHS and our PhD program where you have 4 years of funding. If we have any Hopkins undergraduate students on now or watching the recording, there is an accelerated bachelor's MSPH program where you can finish 1 term early, and that's open to exclusively to Hopkins undergraduate students. And so here's a little diagram of the MSPH. So you heard a little bit from Aaliyah. This is the program that she's in. She's a 2nd year. And so the first year is spent on coursework. Again, you're changing courses every 8 weeks and going through a statistics series. You take epidemiology as well as some courses specifically in our department. And those would be based on your area of interest. Again, those areas of interest that I went through at the beginning are not meant to restrict you, but more to like guide you and just find your place here. Then in the summer and fall of your 2nd year, our students start the field placement. And so that is generally a full-time position for at least 4 months. Some students do decide to do a placement full-time for a couple of months over the summer, and then they'll switch and do a different full-time position in the fall. Other students might do 2 20-hour-a-week positions throughout the summer and fall. But regardless of how you set it up, there is a lot of flexibility. Students are responsible for finding your own field placement. And I'll show some examples, but it's about at least 4 months of full-time work. And so then our MSPH students come back in the spring to complete the master's essay. Aaliyah talked a little bit about what she had decided to do. Again, there's a lot of flexibility in terms of picking the format, the content, as well as your essay reader. To do some work that you are most passionate about, and then everyone shares their work around that a little bit before graduation of their 2nd year. And then in that 2nd year, there's also room to do more coursework. Many of our students complete all of the required courses in the 1st year and then take elective courses in the 2nd year. Sometimes students find during the field placement, a new topic that they're interested in or a new skill set that they want to build based on their field placement. And so having that 2nd year, especially in the spring, to be able to come back and do more coursework can be really beneficial to students. So here are some of our students on field placements in the past. Like I said, there's a huge variety of what people decide to do. So some of our students go abroad. We have a global health established field placement program, as well as students who stay right here in Baltimore and do community outreach work. Again, students are responsible for finding their own field placements, and there's just a lot of flexibility to find opportunities that you're most interested in. Here are some examples of our master's essays. So if you go on our website, you can see recordings of previous master's essay presentations. Again, just a huge variety here in terms of students selecting what they are most passionate about, doing either a data analysis, a scoping review, a policy analysis, and finding a faculty member who they are really excited to work with who will guide you through that project. I'm not going to talk much about our bachelor's MS-PH degree, but again, you could always go back to previous info sessions to learn about that or reach out to us. We have an MHS degree in the department that has some of the same course requirements as the MSPH, but also focuses a bit further on developing research methods competencies. And our MHS students do a master's essay presentation as well. There's no field placement for the MHS. So students either complete the MHS here in person on a full-time basis, and you can complete that in 9 months, or you can do it online or part-time and take up to 3 years to complete the program. We have a PhD program in the department, and our students focus on content area courses. Again, that will be somewhat shaped by your area of interest, as well as focusing on research methods courses that go through from study design all the way through interpretation and sharing results. In addition to courses, our students participate in a research apprenticeship, teaching assistantships, and there's a lot of mentorship along the way to talk about your goals and making sure that you have what you need to achieve those goals. Aaliyah mentioned completing a certificate if you heard her talk at the beginning of this session. So you have the option to complete certificates. You don't have to, but a lot of our students do certificates that usually are like 4 or 5 courses based on a specific content or research area. So you can see here on this slide the certificates that are sponsored by the department. And there's generally, if you're a full-time student, you can fit these in as your electives and there's no extra cost. And you have an official note on your transcript indicating that you completed the certificate. If you go to our website, you'll be able to see all of the centers and initiatives that are based here in the department. You'll see that last one, the Women, Infants, and Children program, or WIC, is what Dr. Gross and Aaliyah were talking about today. And I put a link in the chat earlier. But I really encourage you to go to these different centers, explore, this is a great way to connect with faculty who align with your interests. Again, that was something that Aaliyah talked about, was she found Dr. Gross because she just looked in the faculty directory for faculty who are working on issues that she's passionate about. And so this is a great way to connect with folks here in the school. And I'll just highlight a quote of one of our recent alumni who was able to work on projects that she was really passionate about as a student here. And, I think one way that you can find those projects, again, is to search our centers in our faculty directory. In addition to all of the opportunities inside the classroom, as well as the field placement and master's essays, there's a ton going on in the department in terms of learning about work related to PFRH through our Wednesday seminars. You can check out the recordings on our website. We also have an active department student association that organizes social and volunteer activities, and just a ton of other things happening here at the school and out of the school to ensure that you all are able to connect with students, faculty, and staff in the department and across the school. I mentioned this at some point when we were talking with Aaliyah about the academic support. So you all would have an academic advisor as a student here. We have a lot of program seminars where we talk about the different milestones in whatever program you're in. And then the education team is always here to support you through your academic journey. In addition to all of those sort of structured, formal supports, we always encourage students to build your own mentorship team as a student here. Think about who you want to connect with. You're never going to have one mentor who meets all of your needs. So build your team, and those relationships will last a lifetime. Again, here's a recent alumni, just somebody who talked about in this quote about how much she appreciated the department and really felt like the Pop Fam was a supportive place for her. Let me very quickly go through admissions info. All I'm going to share is that application deadlines have passed for our programs that start this fall. But if you are interested, if you've applied and you've been admitted, great. We hope that you join us in August. If you did not apply and want to start in August of 2027, you would apply by December 1st for the PhD, March 1st for the MSPH or MHS. And then a bachelor's MSPH students, you can apply between your junior and senior year, and then you would be admitted to the program, complete your senior year at Hopkins, and then enter the MSPH program the following year. Here's a little bit about what the application requires. You would complete the application on Sophus. I encourage you to go to our website and explore that link, but basically you need to do the Sophus application, get some letters of recommendation, transcripts from any university you've attended, and then for international applicants, you might have some additional requirements. And there's a lot of info online, or we can talk through your questions. For the MSPH program, our students receive a master's tuition scholarship, which covers 75% of tuition in year 2. There's also need-based scholarships. So if you apply next year. The deadline has passed for this year, but you would complete the CSS profile to be considered for that award. And then we also have department-based scholarships. There's no additional application required. You're automatically considered for those scholarships as you apply and if you're admitted. I will send out these slides to everybody who registered for this event, but there are some more school resources on funding and scholarships, as well as cost of attendance. And then living in Baltimore, I think Mary Alice shared this link as well. I encourage you to look at our past info sessions. We have had similar style conversations with faculty and students in the department who collaborate on projects. So check those out if you are interested in any of these specific topics. We can share our YouTube channel. And please stay in touch. So again, we'll share these slides. Follow us on Instagram, LinkedIn, and reach out if you have any questions. So that's all the slides I'm going to share, and happy to answer whatever questions you have at this point. All right, I see one question from Joseph. Fall, spring, summer, and winter. So all our MSPH, our MHS, and our PhD all start in August. And so you would take courses you would start taking courses in late August. And then our full-time students typically don't take summer or winter courses. Think of a semester system where you have a fall semester and a spring semester. But again, those are just kind of chopped in half. So you have a set of courses for 8 weeks, another set of courses, winter break for about a month, and then courses from late January to mid-May. And Kristen just shared the academic calendar. Thanks. I'll also find a link for international applicants, and we can talk about specific questions, but I also see Kimi has raised their hand. Would you want to ask a question?
Yes. Hi. So I have a quick question regarding, because I'm a junior, I'm a rising senior, and I'm interested in applying for the BA/MS program.
Okay.
And I saw that there's a March 1st deadline for financial aid. So does that mean that if I apply, I will not get financial aid?
Great question. So you're a current junior?
Yes.
Okay. Yep. So the application deadline to apply to the accelerated MSPH program is July 1st. So you can apply before July 1st in the next couple of months, and encourage you to do that. And then you would actually apply for the need-based scholarship when you're a senior and complete that CSS profile by March 1st of your senior year. And then you're considered for that scholarship when you enter the MSPH program once you've graduated from Hopkins. And for that scholarship, we do consider bachelor's MSPH students. Does that make sense?
Yes. Thank you so much.
Yeah, you haven't missed the deadline. So
Okay.
we hope you apply by
Thank you.
July 1st. Yep.
All right.
Joseph?
Yes, thank you for the opportunity. A follow-up on you throw more light on the international applications. I really want to know much about what goes into, you have to do, is it credential accreditation, whatever. Those areas are very technical. And it's well education plus service and whatever. I want to know much about those areas.
Yeah, great question. So for international applicants, I just put a link in the chat that has info specific to international applicants and who is required to submit which additional materials. So there's information about the two big things for international students to keep in mind. One is the English language proficiency test. And so that depends a bit on where you've gone to university. And I would encourage you to check out the link to figure out where you fall there. The admissions office is always happy to answer specific questions. We can look for your specific circumstances as well. And then, for credential evaluations, we also require those if you attended any university outside of the US or outside of English-speaking Canada. So you must do a credential evaluation for your transcripts at universities, again, outside of the US or outside English-speaking Canada. So there's more information about that process on that website I shared as well. And happy to talk more about individual circumstances. I can stay on after this if you'd like. I see a question about funding options from Sadia. So if you could talk a little, Sadia, if you could tell us what program you're interested in, we can talk more about that. Again, for the MSPH program, for our 2-year master's program, all of our students who are in good academic standing receive the master's tuition scholarship, which is 75% tuition coverage in year 2. And then there are additional scholarships, both the department-based scholarships and the need-based scholarships that cover up to 50% of tuition in year 1. And you don't need to do any additional application to be considered for the department-based scholarships. If you want to be considered for the need-based scholarship, you need to complete the CSS profile by March 1st. And then I see a question about when will we hear about financial aid decisions? So we this week have started to release scholarship decisions. There may be additional scholarships for our MSPH students. There may be some additional slots, but at this time we don't know, and we're working to nominate people and have them ready to possibly receive those scholarships if slots open up. And then for financial aid, I think that question is best directed to the financial aid office. The departments aren't involved in the financial aid student loan aspect of all of that. We just do the scholarships, so we can find the email address for financial aid. Mohammed, I see your hand up, but I think that there was one other question I wanted to get to. Do you think a research assistant 20-hour a week would be enough to cover indirect cost of attendance, especially for international students? So we could look at that with you. I think it depends on which program you're talking about. I would encourage you to, again, when I share the slides, you can go to the link for the cost of attendance, and it would depend a bit on the total financial aid package and scholarship package that you have. But we could look at your specific situation with you and take a look at that. I will just say that for research assistant positions for master's students, it's tough to secure those positions ahead of enrolling in the program. I know that some students start reaching out to faculty when they're admitted, asking for research assistant positions, and faculty just really can't guarantee those positions to students before they've matriculated. So great to research faculty with whom you want to collaborate and keep start contacting people once you matriculate into that program. But again, kind of what Aaliyah's situation, what she was talking about, she came and she talked with Dr. Gross. There weren't any immediate opportunities, but then a position opened up the winter of her first year and she was able to start something then. But it wasn't like she had a guaranteed position coming in as a student. Mohammed, did you have a question?
Hello.
Yes.
I have little bit problem about the connection. Okay. I have already sent it to the department for my application for scholarship requests. I think you have seen and you have responded for me. So I am gonna ask you for any further for external scholarships that might help us or might give us for you have already told me that there is 50% chance for the scholarship. So the department, if there is any other external scholarship that could be available for or any initiatives. Thank you.
Thanks. Yep. So We're happy to talk individually after this session with specific to your individual situation. I'll say that for the need-based scholarship, we were able to make some offers yesterday. For that, the department-based awards will go out this week for department scholarships, and then I'll share the slides again. And then there was a link to external scholarships and funding opportunities, and I would say that you could look there. I'll share the link in the slides, but let me also share that link right now. Let me just open it up and paste it in. So again, we are trying to get funding decisions, scholarship decisions out as quickly as we can. There may be additional opportunities after in the coming weeks, though I can't guarantee anything. And so I would encourage you to explore the link that I just put in the chat, in addition to contacting financial aid. Kimi, your hand is up, but I'm guessing that that was from your previous question. Let me know if not.
Yeah, I'm so sorry. I'm gonna lower it right now.
No worries. No worries. All right. Well, it is 1 o'clock, and so we've reached the end of this session. I'm happy to stay on a couple minutes if people have additional questions, but I realize that many of you probably have other engagements that you need to get to. So I'm going to stop recording, but thank you so much for attending. We'll share slides and feel free to reach out if you have any questions.